Here is the first question. It's from a 48 years old lady, Priscilla. She says that she started getting pigmentation on her forehead and on cheeks. She has shared a picture also, doctor. So she's asking what she can do to get it resolved.
Right. Well, the image is not that clear, but then forehead and cheek pigmentation, there are different types when you look at it. If it is diffuse, if it is uniform in pigmentation, the forehead and the cheeks, then I would consider the diagnosis of a photopigmentation. Photopigmentation is a darkening of the skin that happens in response to exposure to ultraviolet rays of the sun. Uh, of course, for that, the first measure would be to start using a sunscreen, and then, of course, to apply depigmenting creams. And then there is a diffuse uniform pigmentation, which is associated with thickening of the skin of the forehead and cheeks as well. In that case, I would consider the diagnosis of acanthosis nigricans. So this is something that happens from within the body. It happens due to a condition known as insulin resistance. Insulin resistance is characterized by normal levels of insulin and normal levels of glucose within the body, but the amount of insulin that is required to sustain the normal level of glucose is slightly higher. And this insulin causes a thickening of the skin of the forehead and the cheeks. So the approach for that would be to get a few investigations done. I usually do a blood workup to get a homeostatic model assessment for insulin resistance done, and then I put them on tablets, and of course a few other creams. So this is about diffuse pigmentation of the forehead and cheeks. If there is pigmentation in the form of spots on the forehead and cheeks, again there are two types. If they have appeared after maybe a pimple, then it just becomes post-inflammatory hyperpigmentation. Well, one can just approach it conservatively by not doing anything at all. It usually comes down on its own in about 2 to 3 months. If it doesn't come down again, we have creams, peels, lasers. That would obviously be the last resort. And then we have freckles, lentigines, and ephyllites. So these are brown color spots that develop on the skin of certain individuals, usually light skinned individuals. So it happens in individuals who are genetically predisposed for developing these. So even a little bit of sun exposure causes them to develop these brown spots. So they are one of the most challenging types of pigmentation to deal with. So the type of treatment usually involves something that destroys the uppermost layer of the skin. So maybe it is radiofrequency ablation or ablation with a laser, or even with trichloroacetic acid may be done. So that is about the pigmentation query that Ms. Priscilla has.
Okay.